Policies are meant to serve humans. That sounds obvious, but in healthcare, it's somehow easy for that to get turned around. The system has policies, procedures, guidelines, rules, collective agreements, budgets, targets, and forms. And those things matter, they really do. But if we put all of that first, people quickly become second. Here's a real example. Leaders have the right to make schedule changes and have the authority to change schedule rotations. They may be following the policy, the process, and the collective agreement. But if the staff affected by those changes are not truly consulted and heard, what happens? Would they feel respected and valued? Would they feel like their life, their family, their health, and professional knowledge matters? Or would they feel like a decision was made about them without them? And that's where trust starts to break. Because technically correct is not always person-centered. Technically allowed is not always human. And technically within the rules doesn't mean people feel respected. That is the invisible pattern. When policy sits above people, the system protects the process instead of protecting care. But when leaders put listening and people first, something changes. The policy, agreements, and process still matter, but now these things work around the humans they were meant to serve. And that is what people-centered systems look like. It does not mean that leaders give everyone everything they want. It does not mean that every decision now becomes easy. It means people are heard before decisions are made. It means staff understand the reason behind the change. It means leaders honor the human impact and not just the technical right to decide. And it means that people are more likely to support what they helped create. And that's what patient-centered leadership helps organizations do. It brings judgment, care, listening, and humanity back into how rules are used. So here's my stand. Policies and processes are not the center of healthcare. People are. If this message speaks to you, my book, Rooted to Rise, is now available for pre-sale, and the link is in the bio. Remember, when people come first, policies become tools for better care. When policies come first, the system can lose sight of who it is here to serve.